Diabetes mellitus, types 1 and type 2, presented by Ashley Ryan and Tracy Kaser. What you need to know. Diabetes is one of the leading causes of death in the world. The number of people with diabetes has nearly quadrupled since 1980. About 422 million people worldwide have diabetes. The risk of cardiovascular disease rises as blood glucose levels rise. In 2012, diabetes was the direct cause of 1.5 million deaths. Statistics. 29.1 million people have diabetes. That's about 1 out of every 11 people. 1 out of 4 do not know they have diabetes. $245 billion is total cost of diagnosed diabetes in the United States in 2012. Two major forms of diabetes. Type 1 diabetes is characterized by a lack of insulin production. Type 2 diabetes results from the body's ineffective use of insulin. Type 2 diabetes is much more common than type 1. Type 2 accounts for the majority of cases of diabetes worldwide. Higher waist circumference and higher body mass index are associated with increased risk of type 2 diabetes, though the relationships may vary in different populations. Early diagnosis and intervention is a starting point for living with diabetes. The longer a person lives with undiagnosed and untreated diabetes, the worse their health outcomes are likely to be. Possible complications. Diabetes of all types can lead to complications in many parts of the body and increase the overall risk of dying prematurely. What can you do? You can prevent or delay diabetes by losing weight, eating healthy, and being more active. You can manage diabetes by working with a health professional, eating healthy, and staying active. People with diabetes can live long and healthy lives when their diabetes is detected and well managed. Type 2 diabetes can be prevented. 30 minutes of moderate intensity physical activity on most days and a healthy diet can drastically reduce the risk of developing type 2 diabetes. While type 2 diabetes is potentially preventable, the causes and risk factors for type 1 diabetes remains unknown, and prevention strategies have not yet been successful. How to avoid diabetes. Talk to a doctor. Make healthy food choices. Stay at a healthy weight and move more every day. Find ways to stay calm during your day and don't smoke. Together, we can stop diabetes.